So before we start, I have to say that this is a teamwork. So you see from the first slide how many people contribute to develop those indexes, and from many countries we keep those patients to be bias-free from all, bias from race influence. So of course, most of you says, okay, this can separate normal from abnormal, but what I need not to separate biomechanically only, because if I could see them on topography, but what are very unusual cases and I don't know what to do. So we recently evaluate more than 100 patients with Forfrust keratoconus or subclinical, defined as the normal eye. We have two eyes. One is absolutely normal, and the other eye is unilateral keratoconus. So let's see if this system is able to detect also the fellow eyes, because of course the two eyes are identical. This is published recently in 2017, is open access. Let's see some clinical example. This is the first case. Everything seems to be relatively normal, 511, 41, 42, and we see the elevation is not pathological. We see the Belling-Ambrosio indexes show absolutely normal values. Everything is the green line. So when you see those patients, regardless of the pachymetry, you could say this is normal cases. But the biomechanical index already show you abnormalities. Let's see the fellow eye. Why is so important this? Because these eyes, at some stage, years before, was in the same condition of the first eye that I show. So the major point is to identify those risky eyes before they show something in topography. And you see the Belling-Ambrosio, the fellow eye, is clearly pathological. And also the indexes, the biomechanical indexes, show pathology. Other cases are the same. We pair those to save your time, so you can compare the pathological eyes on the normal eyes. Apparently, here the pachymetry is even thicker, 529, 44. But both has the same pathological biomechanical indexes. This is another example. Here we have even more thicker, 536. This should be absolutely normal, 43 the center, no elevation. Those eyes are very frequently, and you need to understand which one are risky and which not, because that is the fellow eyes. Probably 10 years before, these eyes was like this. And the indexes clearly identify those cases. Another one. So these are examples to help you to understand this conclusion that is able to be very sensitive and specifically, not only to be able to separate healthy eyes from ectatic eyes, but also to diagnose the Forfrust or the subclinical one at a very early stage. I show another clinical example. This is an unusual unilateral keratoconus eyes. This patient is 55 years old, was referred in Liverpool, and the Pentacam evaluation was a clearly cone in one eye. That is the right one. Here 53, the curvature. The pachymetry is relatively good, 545. This is how look like at the Belling-Ambrosio. That is the fellow eyes. Same curvature, but apparently normal. No risky elevation. 578. So a very good pachymetry. And the left eye, the Belling-Ambrosio, was borderline. What about the CBI? Now, let's see the biomechanics of those cases. One eyes, the right eyes was normal, and also the left. So how can match those findings? If we take more information, asking the patient, he was a rubber in only one eye. So since I was a child, I only rubbed one eye. So this is so sensitive to distinguish what is genetically is predisposition or what you change biomechanical traumatically, because you can have ectasia also after trauma. So that shows you how could be very important to have a clear cut, particularly where we are in doubt, looking at topography. What is it? Could I do some refractive surgery in those cases or not? This is a good guideline and a safe for increasing the safety of your treatment. Thank you.